Hi everyone, Dr. Pannucci here. Wanted to highlight new patient safety research in the abdominoplasty population, published just this month in the Aesthetic Surgery Journal. Now this was research done with Sami Khan, who's a plastic surgeon at Stony Brook as the lead author, and also John Fisher at the University of Pennsylvania, Martin Basta at Brown University. These are all folks that I've worked clinically with and research-wise with in the past, and I was honored when the journal asked me to write the invited commentary, putting their paper's data in the larger context of what's known for patient safety in abdominoplasty. Now, the study looked at risk for venous thromboembolism, which are blood clots in the legs or lungs in the abdominoplasty population. And specifically, they looked at when prevention strategies with anticoagulants are used, what are both the benefits in terms of clot risk reduction and the risks in terms of bleeding of that intervention. And they did so using something called a systematic review, which is not just saying, well, I've done 100 of these cases and here's my results, but actually saying, well, when we look at the medical literature as a whole and aggregate all the data available, what do they show and what can they teach us? So they were able to find multiple studies in the abdominoplasty population that identified both the benefits and the risks of that anticoagulant strategy. And it was very interesting. They were able to aggregate data for about 1,600 abdominoplasty patients. And what they showed is that, yes, anticoagulants, blood thinners, can be safe, meaning that they did not substantially increase the risk for bleeding. However, that finding only matters if the medicines have the effect you intend. And what they also showed is that among abdominoplasty patients that were routinely anticoagulated, there was not a significant reduction in risk for clots. So even though the intervention is safe, it's probably not necessary. We could have anticipated this because existing data does show that the risk for blood clots in the legs or lungs in the abdominoplasty population is around 1 in 500 or 0.2%. And so we also know, based on data for plastic surgery inpatients, that only those at higher risk for blood clots at baseline, something called a Caprini score of 7 or higher, actually benefit from that medicine. Existing data for the aesthetics and ambulatory elective population in plastic surgery support that the overwhelming majority of those patients are actually at lower Caprini scores, and existing data supports, just as this great meta-analysis from Sami Khan and colleagues show, that the majority of abdominoplasty patients should not be anticoagulated. Thanks very much. Wonderful to write an invited commentary for this very important paper. Great work to the authors, and we'll see you for the next vlog.